Greetings. My name is Dr. Mary Milroy, and on behalf of the City of Yankton Health Board, I would like to provide you with information on COVID-19 and tips on how you can keep yourself, your family, and the Yankton community safe. COVID-19 refers to the disease that is caused by a new type of coronavirus named SARS-CoV-2, which was first identified in Wuhan, China in 2019. This new respiratory virus causes symptoms of fever, dry cough, fatigue, and shortness of breath. Studies of COVID-19 suggest that this coronavirus is about twice as infectious as the common seasonal flu virus. This means that an infected person can infect 2 to 3 other persons. This gives the virus the ability to spread very rapidly, and in fact, it has now spread throughout the world. The virus has definitely reached South Dakota, and Yankton County is classified as an area of substantial community spread. The virus is spread by contact with infected persons or surfaces. Unfortunately, infected persons can spread the virus for 2 to 14 days before they develop any symptoms and can unknowingly spread the virus to anyone coming in contact with them. The virus can also survive and remain very infectious on surfaces, especially hard surfaces, for several hours. When infected, about 80% of individuals will develop mild to moderate symptoms and recover. Unfortunately, about 20% of infected individuals get very sick. About 5% need to be hospitalized, and about 2 to 4% die. People over 65 and people of any age with chronic medical conditions such as diabetes, lung disease, heart disease, are especially at risk for a serious life-threatening disease. At present, there's no vaccine and no proven treatment for COVID-19. So, how do we best protect ourselves, our families, our healthcare workers, our first responders, and our Yankton community from this disease? Think safe. That's an easy way to remember. Think safe, and it will help us remember the steps we can all practice to decrease the spread of COVID-19. S is for stay home as much as possible. If you have symptoms of fever, dry cough, shortness of breath, be sure to notify your healthcare provider, but stay home unless your symptoms are increasing and your provider feels you need treatment. If you do not have any symptoms or any known exposure, only leave your home for food, medicines, essentials, or if you work in a critical business. Combine your stops and try to decrease the number of times you leave your home. Make a list and shop as infrequently as possible. Have one designated family member do the shopping. Maybe now is the time to check your freezer, even your cabinets, and see what interesting surprises you can find to cook. I know I have. When you do need to go out, remember to practice safe hygiene by staying at least 6 feet apart from others, wash your hands frequently, and disinfect surfaces of frequent contact, such as push buttons, light switches, or door handles. A is for activity. Fresh air and outdoor exercise are good for our physical and mental health. Be sure to follow safe guidelines, however. Stay home if you are not feeling well. In the parks, maintain 6-foot distances from others. Bring hand sanitizer to sanitize before and after touching any equipment or using the restroom. Supervise your children to encourage safe practice. Park staff is cleaning play equipment and benches very frequently, but safe practices are still important. Yankton parks and playgrounds are open and, with community cooperation, will stay open. F's for our faces. Viruses enter easily through our nose, eyes, mouths. Wash your hands very frequently with soap and water. Avoid touching your face as much as possible. The Center for Disease Control recommends face coverings whenever you leave your home and you'll be in contact with others. Medical masks should be reserved for medical personnel, but fabric masks are easy to make and should be worn by everyone. Instructions are online, and you also could know someone making masks who would be willing to provide you with one if you're not able to make one. E, everyone every time needs to follow safe practices. My daughter made a helpful little sign to help us remember. Safe, stay home. Activity is healthy. Face, cover it, don't touch it. Everyone, every time. Together, we can keep our community safe. Thank you and be well.